Hi, Mr. White. My name is Leah. I've provided privacy for you already. I'm going to be your nurse. Can you go ahead and confirm your full name and date of birth?
David White, December 31st, 1980.
Wonderful. So I see in your chart that you are due for trach suctioning and trach care. The reasoning for this is so that I can take out all the mucus and you are able to breathe properly. Are you currently experiencing any pain?
No.
Okay, if my patient were, I would administer pain meds as needed. I'm going to lower the side rail. I'm going to put you in a comfortable working height and in a semi-Fowler's position. Okay. The first thing I'm going to do is assess your lung sounds. Just go ahead and breathe deeply for me. Okay. Now I am going to place a chucks onto my patient. And I'm going to set the vent to 150 mmHgs as appropriate for an adult. And then set the vents and the suction off to the side. Now I'm going to do hand hygiene. Put on a pair of gloves. And I'm going to open the suctioning package, catheter kit, gently pull out the sterile saline box and set it up. Pour some sterile saline into it. Now I'm going to put on my mask and goggles. And then I will go ahead and dispose of these gloves. Carefully grab my sterile gloves and put them on. Alright, once I have my sterile gloves on, I'm going to pull out the sterile catheter. With my dominant hand, I will coil it, and with my non-dominant hand, I will attach it to suction. Alright, I will uncoil it, assess the patency, and then I will go ahead and dip it in the sterile saline. Now with my non-dominant hand, I'm going to hyperventilate the patient with 3 to 6 breaths. I will insert the catheter to an appropriate length, back towards the oropharynx. And as I'm intermittently suctioning, I'm also going to rotate on my way out. I will do this for 10 seconds. And then remove the catheter. I will ask the patient to cough and deeply breathe for me. And then I will administer oxygen. I would do this for up to 3 times, no more than 3 times. And then when I am done, I will wrap the catheter in my gloves, remove it from suctioning. And at this time, I would also unclamp the trach and remove the dressing. And dispose of all of this inside my gloves. So for the purpose of the video, I'm just going to set it off to the side. Perform hand hygiene. Now I put on a clean pair of gloves. I'm going to take some cotton swabs and I'm going to dip them in the sterile saline, and I'm going to cleanse the stoma in 4 different quadrants.
My name is Gail Theory. I'm a Purdue University nursing student, and I'll be helping you with your care today. I checked your chart, and it says you're scheduled for insertion of a indwelling catheter. What the catheter is for is to
Wonderful. Dispose of that. Dispose of the gloves. I will put on my sterile gloves. I don't have sterile gloves in this kit for the purpose of the video, so I'm using these as my sterile gloves.
And unfortunately, safety again, is there anything you may be allergic to? Perhaps latex or iodine, which is what I would be.
I'm going to grab the new sterile tray. I'm going to use my non-dominant hand and firmly hold the plate, and I'm going to insert the new tray and then press on these clips to lock it in place. Alright.
The curtains for privacy.
And then I will grab
Proper lighting and the garbage
the
in place. Is it okay with you if I'm
sterile tray gauze.
I'm going to start
I'll place it under the plate
and I'm going to
carefully so that the patient doesn't end up coughing and becoming uncomfortable.
I'm going to place a bath blanket over you.
Or perform oral hygiene. Dispose of my sterile gloves. I will grab the new brace, have my patient lift up his head slightly and place it behind my patient. I will remove the old straps at this time.
And I'm going to be placing a waterproof pad.
Place the new strap in. Remove it from the other side. Dispose of this in the trash. Place the other side of the strap in the patient. I would tighten it to make sure that there is room for one finger, and then have my patient move around to make sure that my patient's comfortable. Are you comfortable, Mr. White?
Yes.
All right, then I would dispose of the drape in the trash. I would just take my goggles off and take my mask off.
And then I'm going to change your corner every time I'm going to do a new swipe.
Dispose of it in the trash. I would discontinue the vent. Help my patient into a comfortable position.
I'm going to be rinsing.
Right before that, I will auscultate one more time to make sure the placement of the new trach. Go ahead and take a deep breath. Okay, sounds good. And now I can put my patient into a comfortable position. Lower the bed. And is there anything else I could do for you, Mr. White?
No.
All right. Turn.